So in this video I am going to discuss about the third part of our topic, which is continued, that's congestive heart failure. Let me talk about the treatment, how we can manage congestive heart failure. So as far as congestive heart failure is concerned, the goal of the treatment is we have to increase the cardiac output. How we can improve or increase the cardiac output? This is done by two ways. The first way is either we have to improve the pumping action, or we have to decrease the workload on the heart. How this can be achieved will be discussed in detail. First of all, if there is a heart valve problem, for example, especially in children's, and we have to correct that valve problem, and we can also do a valve replacement. That is the first thing that can be done in patients, especially in pediatric patients. The next important thing I am going to discuss in the management is, we know that in the pathophysiology I have studied about the most common cause is coronary artery disease, or you can say MI. For example, if there is a coronary artery disease, we have got a specific treatment that's known as CABG, that's known as coronary artery bypass graft. So we do a bypass, and by this way we can the clogged vessels, they can be opened up. And the next important thing is angioplasty. In angioplasty, we open up the clogged vessels which are due to atherosclerosis or which are due to coronary artery disease. The next important thing I am going to discuss in the management is, if we have got severe, if the above treatment fails, if there is severe congestive heart failure, in that case either we have to change the pacemaker, we have to apply a new pacemaker, or we can use a VAD, that's ventricular assisted device. Or if the above two treatments does not work, then we have to go for the heart transplant. So continuing with the treatment is, next, how can we manage this congestive heart failure in a systemic way? For example, we know that the most important part of the congestive heart failure is pulmonary edema. How can the pulmonary edema be managed? The first line drug for pulmonary edema is a diuretic that's known as furosemide, or commonly Lasix. And if first of all we have to use furosemide, then we have to add morphine, because morphine is going to decrease preload and afterload, which is what we want as doctors. And if the above treatment is not responding, then we have to go for the nitroglycerin, and then IV nitroglycerin. And if these above three treatments are not responding, then we have to go for the BNP analogs. So the BNP analogs, what are the choices for us as doctors? Three choices. We can use ularitide, and we can also use carperitide, and we can also use nesiritide. And these are the three drugs. This nesiritide, it's a BNP analog, and this carperitide, it's an ANP analog, and this ularitide, it causes urodilation. And the activity of all these BNP analogs is on kidneys. They act on kidneys, cause natriuresis, or you can say diuresis, and due to which the BP is decreased, and blood vessels they undergo vasodilation. And the next important part is they decrease the blood flow to the kidney and heart. That's how they relieve pulmonary edema. Also, one more thing, how we can reduce the burden on heart. This can be achieved by two ways. We have to decrease the heart rate, and we have to increase the vasodilation. As we told about these BNP analogs, how they cause vasodilation. The next important part is we can use diuretics. We have got two choices. One are loop diuretics, and we have got thiazides. The problem with these loop diuretics and thiazides is they both can cause hypokalemia. So whenever we are going to use these drugs, we have to monitor the hypokalemia. And the next important thing is, we can also use a potassium sparing diuretic. For example, spironolactone can be used. But the spironolactone predisposes a problem, it can cause hyperkalemia. So whenever we are going to use the diuretics, we have to monitor three things in these patients. One is hypotension, hyperkalemia, and hypokalemia. Plus, we have to check the serum creatinine levels. And if the creatinine levels rise, it means that there is involvement of the kidneys. Next important thing in the treatment is, we have to use the angiotensin. We have to use ACE inhibitors. What is the action of ACE inhibitors? The ACE inhibitors, they block the action of angiotensin second. It means that when they block the action of angiotensin second, they block vasoconstriction, and we get vasodilation. And the next important thing is, along with ACE inhibitors, ACE inhibitors also help in decreasing the aldosterone, and due to which the edema is relieved. The next important thing about the treatment is the patients who do not tolerate these ACE inhibitors well, we can use ARBs, angiotensin receptor blockers. And the last part of the treatment is which increases the survival in the patients with congestive heart failure is beta blockers. What is the action of beta blockers? Beta blockers, they block the binding of catecholamines, especially norepinephrine, on the beta receptors on the heart, and due to which the workload on the heart is reduced. That's how we can manage the congestive heart failure. So we talked about all the how strategies and management of congestive heart failure. I hope this is going to help students in managing congestive heart failure. Thank you so much.